The full syndrome of Lyme disease was first recognized in southeastern Connecticut in towns including Lyme and Old Lyme in 1975. Lyme disease is an infectious disease spread by ticks and caused by bacteria. Usually, Lyme disease is caused by the bacteria Borrelia burgdorferi. Lyme disease is transmitted by ixoid ticks, usually Ixodes scapularis or the deer tick. Only larvae, nymphs, and adult female ticks require blood meals, and only ticks in the nymphal and adult stages can transmit the disease. The risk of Lyme disease is highest during the time of year when the nymphs are seeking a meal, the summer. These ticks also carry other disease-causing organisms. This slide shows the size of a nymph deer tick in comparison with a human fingernail. Once the bacteria is in the skin, one of three things may happen. The bacteria may be eliminated by the host defense system. The bacteria may be viable and localized in the skin, where it produces erythema migrans, the characteristic skin lesion of Lyme disease. It usually appears at the site of the tick bite about a week after the bite has occurred. The rash usually is not itchy or painful. About 70 to 80% of infected people develop a rash. Finally, within days to weeks, bacteria may disseminate through the lymphatics or blood. After entering the circulation, the bacteria tends to go to the skin, heart, central nervous system, joints, and eyes. Lyme disease generally follows three stages of disease progression. These include early localized, early disseminated, and chronic disseminated. The first stage generally occurs within 30 days of the tick bite. Most patients present with erythema migrans at the site of the tick bite 1 to 2 weeks after the bites. Other symptoms include fatigue, muscle ache, joint ache, headache, fever, chills, neck stiffness. The second stage generally occurs weeks to months after the bite. Musculoskeletal and neurologic symptoms are the most common. Less common are cardiac and skin findings. The third stage of Lyme disease happens months to years after the infection. The symptoms mainly involve joints and the nervous system. The prognosis of Lyme disease is generally excellent when they are treated early with appropriate antibiotics. Lingering symptoms, which may persist for more than 6 months, affect 10 to 20% of patients who receive recommended treatment. This is called post-treatment Lyme disease syndrome and includes cognitive disturbances, fatigue, joint or muscle pain, headaches, hearing loss, vertigo, mood disturbances, paresthesias, and difficulty sleeping. Lyme disease is endemic in North America, Europe, and Asia. In the United States, over 30,000 cases of Lyme disease are reported each year. The CDC publishes the results reported in the United States. This is the map of reported cases from 2018.